Bob Seeley.
Thank you very much indeed, Madam Deputy Speaker. Good evening to you. I'd like to make three brief points. Firstly, vaccination undoubtedly is a significant, great success story, and I thank all involved nationally and on the island. On the island, we've vaccinated well over 10,000, probably about 12,000 people so far, so it is underway. And on the island's four sites which are vaccinating at the moment, so Carisbrooke, the Bay Practice, Westridge, and doctors and nurses working out of the West White Sports and Community Centre in Freshwater, as well as the hospital as well. My slight concern, which I'd be grateful to get a direct answer from the Minister on, and I have written to the Secretary of State and Vaccine Minister, the vaccine hub at the Riverside Centre in Newport is expected to be ready on the 15th of January. Earlier today, in the question, I accidentally said 15th of July. Clearly, I meant the 15th of January, so it's going to be ready in about 3 days. We may not, however, receive the vaccines for it and the sign-off for at least 10 days and potentially more afterwards. We are therefore potentially missing out on vaccinating about 500 people per day. And over 10 days, that's 5,000 people who could have had a first jab. Now, with our rise in infection on the island, our demographic profile and our isolation and our dependency on ferries and potentially helicopters, I am concerned that we are not high enough above the vaccine supply list, not for the 4 PCNs, primary care networks, but for our vaccine centre. As I say, I've written to the Secretary of State about this, but it would be great to get an answer. Secondly, can we have a medium-term outline of what lies ahead? Businesses need clarity, and people, especially in the hospitality sector on the island, in the festival sector, they need to be able to plan to know if they can reopen in April or in May or later in the summer. Now, we know that 50% of deaths sadly come from the over 80s, and 88%, nearly 90% of deaths are in the top 4 at-risk categories. If those good folks are all vaccinated on time, take into account the 3-week period afterwards that it takes for the vaccine to come live, by early March, we should be clear of nearly 90% of deaths. That then begs the question, will we be coming out of lockdown at that point, or will the government then say it's not about mortality, but about prevalence of COVID? We need, I think, clarity and a decision on this as soon as possible. And finally, just related to this, the Isle of Wight is Britain's festival island, and the government needs to think about support for festivals because they are planning already and their decisions are being made in the next few weeks, and help for that sector would be gratefully received. Thank you.
Thank you.